Fontan procedure treats children born with single-pump congenital heart disease. IJN has performed this surgery on hundreds of young patients over the years. I'm Azaria Tagaya, here to discuss an innovative solution for a small group now facing complications.
So as we know, the Fontan surgery is basically the treatment for the children that born with single ventricle or single pump. And the fenestration created during surgery. And in our institution, we have been following up hundreds of patients post-Fontan surgery. And there is a small group of patients who has significant cyanosis or blueness, and oxygen saturation is around 60s, 70s or low 80s, which is not normal. This is very significant, especially to ensure that this patient has better saturations, better quality of life, and patient can go to school, doing activities, and more importantly, to have good life with family members and also involved in school activities.
Yeah, it's not very common at all because there would be just case reported around the world, from Europe, from India, or some part of the world, maybe just a couple of cases. Same here in IJN. Well, today we plan to have like 4 cases. I think more than 100 cases have been doing the bypass like that, venous bypass, so-called the Fontan procedure here at IJN. But as you can see, that just a few patients needs to to help by putting the hole getting smaller.
While most Fontan patients show acceptable long-term outcomes, about 5 to 10% develop severely low blood oxygen levels later in life, resulting in cyanosis and oxygen saturations of around 60 to 80%, instead of the normal 95% and higher. This prevents adolescent patients from normal school and activities. Intervening carries risk, but IJN aims to study implanting cardiac devices like AFR, a small device that regulates circulation rather than completely closing surgical fenestration on whole from the initial procedure. This improves oxygen saturation levels by regulating flow through the surgical fenestration instead, by undersizing the hole. The goal is to improve quality of life without added strain to the circulation.
This device is actually designed for a patient who has heart failure. It's either the weak right ventricle or the weak left ventricle, and the fenestration or the atrial flow regulator is basically helping up to offload the high pressure in the failing pump. This device is used for today's procedure, like the Fontan fenestration downsizing size is basically the compassionate use for this group of patients.
As a specialized center experienced in managing Fontan cases from childhood onwards, IJN is poised to evaluate outcomes of strategically utilizing AFR and similar devices for patients with few alternatives. By tackling the root physiological issues precisely, building multidisciplinary expertise in this realm is key.
I think it's good to, moving forward, I think it's good to have a multi-center experience and study the outcome of this device occlusion, of partial occlusion of Fontan fenestration, and basically we will come out with a more precise data on patient post-partial closure of Fontan fenestration.
IJN continues trailblazing innovation in caring for congenital heart patients into adulthood, giving hope to young patients as they pass each milestone. This procedure highlights their commitment to enhancing outcomes through a patient's lifetime. Stay tuned for more IJN updates. I'm Azaria Tagaya. Thanks for watching and don't forget to subscribe.